All right, let's dive into something pretty interesting today. Um, we're going to be talking about hungry bone syndrome,
Yeah,
and I think that name is really evocative.
it is.
So this deep dive is going to be on hungry bone syndrome, and it kind of sounds like a medical paradox. It's a
Mhm.
situation where after surgery to remove the parathyroid glands, your bones, they just become so hungry for calcium,
Yeah.
and it can cause a lot of
Yeah,
problems.
I
And it happens when parathyroid hormone levels are normal or even high.
Yeah, it's really quite the paradox. You see, parathyroid hormone, we call it PTH a lot of times, is really important for regulating calcium in the body.
Right.
One of the ways it does that is by encouraging the release of calcium from bones into the bloodstream.
Okay.
But in hungry bone syndrome, it's like the bones just can't get enough calcium even when the PTH levels are normal.
So it's almost like the signal to stop absorbing calcium is lost.
Yeah, that's a really good way to put it.
Okay.
And to really understand why this happens, we need to look at the role of the parathyroid glands themselves. So these are these tiny little glands in your neck. They produce the parathyroid hormone, the PTH. And
Okay.
PTH acts like a messenger. It tells the bones when to release calcium.
Yeah.
But sometimes these glands can develop tumors that cause them to overproduce PTH.
Oh.
And that leads to a condition called hyperparathyroidism.
So too much PTH, too much calcium in the blood.
Exactly. And with all this extra PTH, the bones are put in a state of constant breakdown and rebuilding, sort of a accelerated bone turnover.
Okay.
And over time, this weakens the bones, and it can lead to a condition called osteitis fibrosa.
And that's when the parathyroid glands are surgically removed.
Precisely. Removing the overactive gland seems like the logical solution.
Right.
But that's where the hungry bone syndrome can kind of emerge.
Yeah. It's like this. Now I see where the paradox comes in. So
Yeah.
removing the source of the excess PTH actually backfires in a way.
It can, yeah. Because the bones have been in overdrive for so long. When you suddenly take away the PTH, it throws them into a calcium frenzy. They start absorbing calcium from the bloodstream like never before. And this leads to hypocalcemia.
Okay. So this hunger for calcium, is it a rebound effect?
That's a good way to think about it.
Okay.
And how severe this hunger is really depends on how much the bones were affected by that extra PTH in the first place.
Right.
The more severe the bone disease was before surgery, the more ravenous the bones become afterward.
Okay, so the hungrier the bones, the more severe the hungry bone syndrome will be.
Yeah.
But how do doctors actually figure out who's at risk? Are there like warning signs?
There are definitely warning signs. One of the biggest ones is the size of the tumor on the parathyroid gland.
Okay.
So imagine the larger the tumor, the louder the signal has been for the bones to release calcium, and the harder it is for them to adjust when that signal suddenly disappears.
So a bigger tumor usually means a rougher transition.
Yeah.
What else are doctors looking for?
They're also looking at specific markers in the blood. You can think of them like clues that reveal how severe any pre-existing bone disease is.
Okay.
Things like blood urea nitrogen and alkaline phosphatase levels. These paint a picture of what those bones have been through.
Okay.
Older patients also tend to be more susceptible.
Yeah. Okay, so we've talked about what triggers hungry bone syndrome and who might be at risk. What does it actually feel like? Like, what are the symptoms?
The symptoms are primarily those of severe hypocalcemia. And remember, calcium isn't just about strong bones. It's really important for muscles and nerves to function correctly. So when calcium levels get really low, things can get pretty uncomfortable and even dangerous.
And uncomfortable how?
We're talking about things like tetany, which is like uncontrollable muscle spasms and cramps. Some people even experience seizures.
Oh, wow.
And in the most serious cases, you can get heart rhythm problems or even a spasm of the vocal cords, which can be life-threatening.
Okay, so hungry bone syndrome, this is not something to take lightly. But let's say someone does develop it. What can doctors do to treat it? Or even prevent it from happening in the first place?
You're right. Early intervention is key. And the good news is there are effective ways to manage hungry bone syndrome. And there are even some pretty promising strategies for prevention.
That's good to hear. But before we get into all of that, I think it would be helpful to hear about a real-life case of hungry bone syndrome, just something to really bring this condition to life for our listener.
I think that's a great idea. Real-life examples can be really powerful.
Yeah. So I found this case in the research that really caught my eye. And it involved a patient who, like we were just discussing, developed hungry bone syndrome after surgery for primary hyperparathyroidism.
Sounds like a classic presentation. Tell me more about this patient. What symptoms were they experiencing?
Well, before the surgery, this patient had fatigue, muscle weakness, and they even had kidney stones. And blood tests revealed high calcium levels, which pointed to hyperparathyroidism. And an ultrasound then confirmed the presence of an adenoma on one of the parathyroid glands.
Pretty textbook.
Right. The patient then had surgery to remove the adenoma, which is a pretty straightforward procedure. But here's where things took a turn for the worse. In the days following the surgery, they started experiencing some pretty alarming symptoms.
I'm guessing the tetany and seizures we were talking about?
Yep, you got it. The muscle cramps and spasms were so severe that the patient was practically immobile, and then they had a seizure, and that landed them in the emergency room. And blood tests, of course, confirmed that their calcium levels had just totally plummeted, which is a clear sign of hungry bone syndrome.
Yeah, that's not uncommon, unfortunately. It can take a few days for the calcium levels to drop low enough to cause any noticeable symptoms.
Okay.
So what happened next? How did the doctors manage the situation?
So they acted quickly, starting intravenous calcium infusions, just to try to get those levels back up as fast as possible. And they monitored the patient very closely for any signs of heart problems or any breathing difficulties, which can happen when hypocalcemia is that severe.
Yeah, it sounds like this patient was in good hands. Quick action is really crucial in these cases.
Definitely. And thankfully, after several days of intensive treatment, the patient's calcium levels did start to stabilize, and the symptoms slowly subsided. But they did need ongoing calcium and vitamin D supplements for several months after that.
That's typical. Recovery from hungry bone syndrome takes time. Long-term management is often necessary to prevent those calcium levels from dipping again.
So this case really highlights the importance of understanding hungry bone syndrome, not just for doctors, but for anyone who might be going through parathyroid surgery. It's not something to take lightly.
Yeah, I agree. It really highlights how interconnected our bodies are, and it brings up a fascinating question. What happens to those bones after someone recovers from hungry bone syndrome? Do they ever truly go back to normal? That's something we need to explore a bit further.
Yeah, that's a great question. And it's the perfect lead-in to the next part of our deep dive, where we'll get into the treatment options for hungry bone syndrome and what patients can expect in the long term. So stay tuned.
All right, so let's delve a little deeper into those treatment options for hungry bone syndrome. As we talked about earlier, the main thing is addressing that hypocalcemia, and that often means we have to use calcium supplementation.
Okay, so replenish the calcium that those hungry bones are, gobbling up. Is it as simple as just taking some calcium pills?
It can be a little bit more nuanced than that. You see, the delivery method, like whether it's oral or intravenous, really depends on how severe the hypocalcemia is. So for someone who's dealing with like really severe symptoms, like muscle spasms or seizures, we have to go with intravenous calcium.
Okay,
It's the fastest way to get those calcium levels back to a safe range.
like a rapid response unit for calcium emergencies.
Exactly. But intravenous calcium is not without its risks. It needs to be given slowly and carefully, because if you give it too quickly, you can actually trigger heart complications.
Okay, that makes sense. So what about folks who aren't experiencing those severe symptoms? What does oral calcium supplementation look like?
So for milder cases, or once the acute phase has kind of subsided, oral calcium supplements can be really effective. The dosage is going to vary from person to person, but we often prescribe several grams of elemental calcium daily.
Several grams. Wow, that's a lot.
Mm.
Are there any things that folks should be aware of when they're taking that much calcium?
There are a few things to consider. One thing is that calcium can bind to phosphate in the digestive tract, and that makes it harder for both to be absorbed. So if someone also has low phosphate levels, what we call hypophosphatemia, the timing of the calcium supplements is going to be crucial.
So maybe avoiding calcium supplements with like a big glass of milk.
That's a good rule of thumb, yeah.
Yeah.
It's usually best to take calcium supplements between meals for the best absorption. And we should probably also touch on vitamin D here. We've mentioned it's often part of the treatment plan.
Right. Vitamin D, I know it's linked to calcium, but remind me about that connection.
Vitamin D is like calcium's best friend. It helps it get absorbed from the gut into the bloodstream.
Oh.
So even if you're taking tons of calcium, it's not going to do much good if you don't have enough vitamin D.
So they're a dynamic duo,
Mm-hmm.
but isn't sunlight a pretty good source of vitamin D? So do people with hungry bone syndrome need to just start sunbathing all day?
Sunlight is a fantastic source, you're absolutely right. But for folks recovering from this syndrome, they usually need supplementation.
Okay.
And for people with end-stage renal disease, they often have trouble converting vitamin D to its active form.
Right.
So in those cases, we may prescribe calcitriol, which is like a prescription form of vitamin D.
Okay, so it's all about making sure the body has what it needs to use that calcium effectively. Now, you mentioned dialysis earlier.
Mhm.
When does that come into play?
Dialysis is typically reserved for those severe cases of hypocalcemia that just aren't responding to other treatments. It basically acts as a filter. It removes excess waste and fluids from the blood. And the key here is that we can use a high calcium dialysate to boost those calcium
It's like
levels.
the customized solution for hungry bone syndrome.
You got it. And for people who are on peritoneal dialysis, which is a type of dialysis that's done at home, we can actually add calcium directly to that dialysis fluid.
Oh, wow. Okay, so we've covered how to treat the low calcium levels.
Hmm.
But what about those other electrolyte imbalances that can pop up, like, low phosphate, low magnesium, high potassium?
Yeah, those definitely need to be addressed. But the approach can differ between patients with primary hyperparathyroidism versus those with end-stage renal disease.
Okay, why is that? What makes it different between those two groups?
Well, with primary hyperparathyroidism, those other imbalances are often a side effect of that excessive PTH. So once those overactive glands are removed, those imbalances tend to sort themselves out naturally. Like the body's just reestablishing its natural equilibrium.
So you're removing the root of the problem, those overactive glands, and then the downstream effects result.
Yeah, precisely. But with end-stage renal disease, it's a little bit more complicated. The kidneys are really important for regulating electrolytes, so we might need to use medications or adjust the dialysis regimen to address those imbalances. For example, hyperkalemia or high potassium can be a real concern after parathyroidectomy in folks with end-stage renal disease.
I know potassium's an electrolyte, but why is high potassium so dangerous?
So high potassium can interfere with the heart's electrical activity, which can lead to arrhythmias or even cardiac arrest.
Oh, wow.
So it's really important to monitor those potassium levels very closely and adjust the dialysis accordingly.
Wow, it's serious. This really underscores the importance of that close monitoring after surgery you were
Yeah,
talking about earlier.
absolutely. And we can't forget about magnesium. Low magnesium, what we call hypomagnesemia, can actually worsen the hypercalcemia. It interferes with PTH secretion and the body's response to PTH.
So low magnesium could lead to even lower calcium levels, like a vicious cycle.
Exactly. That's why it's so important to check those magnesium levels and address any deficiencies. Sometimes just correcting that low magnesium can make a huge difference in how well someone responds to calcium supplementation.
This is a lot to consider. But we've mostly been talking about treatment after hungry bone syndrome develops. What can doctors do before surgery to prevent it from happening in the first place?
There are a few promising strategies, like we talked about earlier. One approach is to use calcitriol, that active form of vitamin D, in the days leading up to the surgery. And this can help boost calcium absorption and potentially reduce how severe that post-surgical hypocalcemia is.
Like prepping the bones for that calcium wave that's coming.
Yeah, that's a great way to put it. And some doctors recommend starting oral calcium supplements a few days before surgery, even for patients who have high calcium levels before the operation.
Wait, really? I would think giving them more calcium before surgery, when the goal is to lower calcium, would be counterproductive.
I know, it seems a little counterintuitive, right? But the idea is to saturate the system with calcium beforehand. That way, when the bones kick into overdrive after surgery, there's already a good supply of calcium in the bloodstream.
Okay. So like providing a calcium buffer.
Precisely. Now, there are other preventative measures being explored as well. Some research is looking at the use of cinacalcet. This is a medication that lowers PTH levels. So the thinking is, by suppressing PTH before surgery, you can smooth out that transition for the bones, preventing that sudden drop in bone turnover that triggers hungry bone syndrome.
So like weaning the bones off their dependence on that high PTH signal. Now, what about those medications that are used to treat osteoporosis, bisphosphonates? I've heard those mentioned in connection with hungry bone syndrome prevention.
Yeah, bisphosphonates have been looked at in some cases, but the evidence supporting their use for specifically preventing hungry bone syndrome is still pretty limited. They work by slowing down bone resorption, which theoretically could help prevent that excessive calcium uptake after surgery. But we definitely need more research to confirm whether they're really effective for this specific purpose.
So a lot of potential avenues for prevention, but the research is still ongoing.
Yeah, you hit the nail on the head. But what I think is really fascinating is even with all the knowledge we've gained about hungry bone syndrome, there's still so much we don't fully understand.
Like what? What are some of the big unknowns that you're still grappling with?
For instance, we know that the severity is linked to how much pre-existing bone disease there is, But we haven't quite figured out why some people have really severe symptoms while others sail through with minimal issues.
Like there are individual variations that we haven't quite pinned down.
Exactly. And what about the long-term outcomes? Do those bones fully recover? What's the risk of developing other bone problems later on down the road? These are questions that deserve a lot more investigation.
Sounds like a ripe area for research.
It really is. And, for our listener, I think this deep dive is just the tip of the iceberg. There's a ton of great information out there about hungry bone syndrome and parathyroid disorders in general.
It's true. Learning's an ongoing journey.
Absolutely. And, we've covered a lot of scientific ground here, but we also need to acknowledge the human side of this condition. I'd love to get your thoughts on the psychological impact of hungry bone syndrome.
Yeah, that's something we haven't really talked about yet. And it's so important. I mean, it must be so difficult to go through major surgery hoping to feel better, only to then be hit with these debilitating symptoms that can linger for weeks or even months. It's
Yeah.
got to be incredibly frustrating and discouraging.
You're absolutely right. Imagine going through this process feeling like your own body has betrayed you. So how can patients even begin to cope with that kind of emotional roller coaster?
Yeah, that's a great question. Where do you even begin to process those feelings?
Well, first and foremost, healthcare providers have to acknowledge and validate those feelings. Open and honest communication between the patient and the doctor is absolutely crucial.
So it's not just about treating the physical symptoms, but also providing emotional support and understanding.
Exactly. Additionally, connecting patients with support groups or even therapists who specialize in chronic illness can be really beneficial.
Yeah, I imagine that sense of shared experience of not being alone would be so helpful.
It really can be. And sometimes simply having a name for what they're going through, understanding that it's a recognized medical condition, that in itself can be surprisingly empowering for patients.
It removes that sort of fear of the unknown.
Yeah, exactly. And I think that brings us to a natural stopping point for this part of our conversation.
Yes, I think that's a good place to pause for now. But before we move on, I want to leave our listener with a thought-provoking question. What are the long-term implications of hungry bone syndrome for bone health?
That's a fantastic question, and one that we will definitely be delving into when we return for the final part of our deep dive.
Welcome back. Ready to wrap up our deep dive on hungry bone syndrome. We've explored a lot, from the mechanisms to treatment options and even the emotional impact. But before we close out, I want to circle back to that question you brought up earlier.
The one about the long-term impact on bone health.
Yes, exactly. We know about the hypocalcemia, that immediate crisis. But what about the long term? Do the bones ever really recover from this calcium roller coaster?
That's a question I hear a lot from patients. And to be honest, there isn't a straightforward answer. We know that in most cases, if the treatment is right, the acute phase of hungry bone syndrome does resolve. Calcium levels go back to a normal range.
Okay, that's good.
It is, but that long-term impact, that's something we still need to study more. There's a valid concern that, even after that period of calcium depletion, there could be some lasting effects, especially for folks who had some bone disease even before all of this.
So even when the calcium levels get back to normal, there could still be some damage.
That's the worry. And this is especially true for patients with end-stage renal disease. Their bone health is often already compromised because of their kidney failure.
Right, so it's like they're starting from behind. So what are some of the long-term risks that we should be thinking about?
Well, one big one is an increased risk of fractures. Remember, those bones have been through a lot. First weakened by the high PTH, then depleted of calcium.
It's a double whammy.
Exactly. And even if there aren't any fractures, there's still a chance of decreased bone density, which means those bones are more fragile, more likely to get injured in the future.
That is concerning.
Yeah.
So what can be done to lower those long-term risks?
Being vigilant is key. After someone recovers from hungry bone syndrome, we need to keep an eye on their bone health. Regular checkups with their doctor, maybe some bone density scans, just to track any changes.
So it's not a treat it and forget it kind of thing.
Nope, we need to stay on top of it. And of course, lifestyle choices play a role too. Getting enough calcium and vitamin D, either through diet or supplements, is super important.
Right, keeping up with those bone-building nutrients.
Exactly. And don't underestimate the power of exercise. Weight-bearing exercise can really help build up bone density over time.
It sounds like we need a combination of medical monitoring and healthy habits for those bones to stay healthy in the long run.
Absolutely. And I always encourage patients to be their own advocate. Ask questions, stay informed, and work with their doctor to manage their bone health.
That's a great point. The more we understand about conditions like hungry bone syndrome, the better we can handle them.
Definitely. Going through this deep dive, what really struck me is how interconnected everything is. Hormones, bones, calcium, it's all about keeping that balance in the body.
It's like a carefully choreographed dance. When one dancer is off, the whole routine falls apart.
That's a perfect way to put it. Hungry bone syndrome really shows us what can happen when that balance is thrown off. But with the right treatment and a proactive approach, we can help patients recover and keep their bones healthy.
I agree. Well, to our listener, thank you so much for joining us on this exploration of hungry bone syndrome. We hope you found it helpful and learned something new about this often overlooked condition.
And remember, this is just the beginning. There's tons of great information out there, online, and through organizations focusing on parathyroid disorders. Keep learning.
We'll add some links to those resources in our show notes. And until next time, stay curious and keep those bones strong.